Hi, my name is Cailey Langerak. I'm a second-year Doctor of Physical Therapy student at Regis University. I am a retired elite gymnast, so I have a lot of good hands-on experience from being a high-level athlete and being in a stressful competitive environment. Like many, I became interested in physical therapy because I did have an injury. But unlike those people, I've had a lot of long-lasting repercussions that I've had to work through, whether it be mental or physical. And I feel like from that long and hard recovery, my tenacity and drive have led me to be able to make the most out of my abilities, and it led me to this career. As a former athlete and coach, I'm very interested in the area of sports and orthopedics. I am aware that this is a very competitive and specific area of practice, and it takes someone who can relate to these patients on a competitive level, as well as someone who has the determination to continue to motivate and educate all of my patients to better themselves no matter what their abilities are. I had the opportunity to have my first clinical at Hands-On Physical Therapy in Cheyenne, Wyoming. It was my first time living out of state, which was definitely an adjustment, but I was able to keep an open mind and make the most of it. I found that being flexible and being able to adapt was extremely important in any situation during that time. And I find that being level-headed to problem solve and draw from previous experience, as well as staying organized, are really important, as well as keeping in mind my patients' goals to still give them the best outcome no matter what the situation might be happening. My CI praised me on my ability to be reliable, efficient, and a quick learner. The other strength I bring to the clinical environment is a good rapport with patients as well as colleagues. I have a strong compassion for others, and I'm able to communicate effectively. I receive constructive feedback the best when I've had time to reflect on my own performance, but I do appreciate outside feedback as I can't exactly see anything that I'm doing. I can just feel if it feels right or wrong. And my previous CI would give me feedback at the end of the day by asking if I had any questions or how I just felt like my patients were doing that day, which I felt like was kind of delayed, as sometimes I wasn't able to remember maybe patients at the beginning of the day that I specifically worked with. So I think in the future I will definitely make it known that I want to receive feedback at the end of each session if I can, and definitely make an effort to ask questions if I need to hone in any other skills, and ask if there is anything that my CI notices that I'm needing to work on or fix. And then if it needs more time, we can set aside any extra time we have or at the end of the day to work on that. And prior to starting clinical, I plan on reviewing any specific coursework that might be applicable to the patient population or problems, like contact from musculoskeletal management courses, like joint manipulations, mobilizations, and special tests. I also plan on taking the dry needling elective that Regis offers to finish my remaining dry needling hours to get my certification. And I would like to pursue the sports elective so that I can get more specific hands-on experience with what I might be doing with that population. And after graduation, I feel like I'm headed towards taking a job in an outpatient musculoskeletal clinic to be able to treat athletes as well as other orthopedic injuries and disorders of any age group and population. I'm also considering applying for a sports or orthopedic residency to further hone in my skills, to add to my toolbox, as well as a deeper understanding of the musculoskeletal systems and even the neuromuscular system. Thank you for your time watching this video, and I will talk with you soon.